Day surgery is defined by the Australian Day Surgery Council as an operational procedure excluding an office or outpatient procedure where the patient would normally be discharged on the same day. Day surgery carries its own set of risks to the patient, as nursing education, observation and care must be accurate and thorough to ensure patient outcomes. Patient education is essential to recovery. Day surgery typically involves patient discharge occurring on the same day. Therefore, it is very important that the nurse discusses both pre-operative and post-operative practices with the patient. Pre-operative education includes providing information regarding fasting, hygiene, and any specific instructions the doctor has ordered for the procedure. For example, bowel preparation prior to a colonoscopy. Post-operative practices that may be discussed prior to surgery include avoiding driving or operation of heavy machinery, adequate fluid and nutritional intake, and prompt ambulation. Managing patient expectations regarding the anesthesia and procedural details are important to ease patient anxieties. Patients require adequate assessment to minimize risks associated with anesthesia and surgical recovery. This includes the pre-operative interview, which may or may not be structured. This will help to obtain relevant information regarding the patient's medical history, including any pre-existing conditions, previous surgeries, surgical complications, and issues with anesthetics. Anxieties over surgery and anesthesia should also be addressed. The perioperative nurse should also establish a baseline for vital signs. Consent forms should be followed up by the perioperative nurse, and ensuring that the form has not only been signed, but that the patient understands the procedure and the risks associated with it is important. This will facilitate informed consent, and it provides a patient with the opportunity to any questions. Patients may feel embarrassed to ask questions or intimidated by medical language to ask their doctor. Therefore, it is important to provide the patient with the opportunity for clarification. Certain procedures assist the perioperative nurse to optimize patient outcomes. The preoperative checklist aims to ensure that all preparation for surgery has been completed to maintain a safe, legal, and quality surgery. The checklist enables the nurse to account for the patient's fasting status, hygiene, presence or absence of body jewelry, prosthetics, hearing and seeing aids, dentures, consent, health history, diagnostic test results, and patient identification labels, among others. This is important as a missing blood test result or incorrect identification label may impact the patient. Issues with patient recovery can impact quality of life beyond discharge. This is one of the many reasons why checklists are important for patient safety. Post-anesthetic care tools are used to minimize the likelihood of an adverse event post-surgery and are shown to be effective in doing so, according to Street et al. 2015. In summary, the perioperative nurse plays a key role in the safe and quality recovery of the day surgery patient. Through accurate and thorough education, observation and care, this can be achieved. And thank you for your time.